Hi class, the purpose of this video is to review the screening process that you are going to be required to take part in this quarter. The purpose of you bringing in screening patients is to increase the diversity of the patients that you are going to have assigned to you while you are on clinic during your senior quarters. Now, generally, what you will notice is that you are not going to be assigned the ideal patients that you will need in order to complete all of the requirements, the competencies that will be due at the end of each quarter. So it becomes imperative that you consider bringing in your own patients, which will potentially require some of the treatment to be completed that will help you get some of these competencies taken care of. Now, each quarter, starting with your fall quarter and continuing into winter and spring, you are each going to be required to bring in 3 screening patients. A screening patient is an individual who you specifically speak with and bring into the school yourself. A new patient who one of the coordinators assigns to your schedule does not count as a screening patient. A screening patient is someone who you specifically obtain. Now, when you obtain said screening patient, you are going to make an appointment. Most of the time, students will reserve their typodont in their clinical schedule so that a patient is not filled into that time slot. But the other option is to, if you are familiar with your screening patient, if they happen to be a brother, mother, something of that nature, you can go ahead and have them complete the new patient paperwork ahead of time. Bring that in to one of the coordinators, have them create a chart ahead of time, and then at that point they can go ahead and put in that patient's actual chart number into your Axiom schedule. If that works out, it's great. It does save a little bit of time, but if we're not able to do that, then the patient will have to go through the chart creation process at the beginning of their appointment, which does take a little bit of time. Regardless of whether the chart is created before they arrive on campus or not, they will have to sign their consent forms at the check-in desk. That is done electronically, and that is done before the patient can be moved into the back, into the clinic. So once you go ahead and bring your patient back, you've got them scheduled, they do sign their consent paperwork, you're going to bring them back in, and you are going to complete a health history, complete vitals, and an EO/IO. Those are the 3 main aspects of the clinical appointment that do need to be completed, regardless of whether the patient is going to stay and obtain treatment through you or through the school as a whole. So you will bring the patient back, you will bring up their chart, you will ensure that they have signed all of their consent forms. You will unlock the chart if they have done that. A lot of times you'll notice that there is a little lock at the bottom of the Axiom chart next to their chart number. So you will click on that lock, which will give you full access to the chart. You will then complete health history, including the health history form in their chart. You will complete vitals, and you will complete an EO/IO. Now, once you have done this, you can go ahead and let your faculty know, inform them of such. And you will next pick up your Explorer and you will look for calculus. Now, obviously, we are looking for moderate calculus, heavy calculus. We are not looking for grainy roughness. We're not looking for a lot of stain, and we don't care much about supra. So depending on what exam you're looking for is obviously going to depend on specifically what you're looking for when you're exploring and when, of course, you are spot probing. If you feel like there is some calculus, it looks promising. If you feel like when you spot probe on a couple teeth and a couple quads that you notice you're mostly getting 4, maybe 5 millimeter pockets, that's really ideal for most of the senior exams that you're going to be taking. Do recognize, you guys can look at your exam flow chart. You will notice that the SRP exam is light to moderate calculus, whereas the CBC exam is moderate to heavy subgingival calculus. So depending on what exam we're looking for is obviously going to kind of determine which patients you're going to move forward with a workup and which patients you will discontinue the treatment for. Now, some patients want to get the treatment done regardless of whether they qualify. So let's say you want to bring your mom in as a screening patient. She comes in, you're hopeful that maybe she qualifies for your SRP exam. You do a quick screening, you explore around, you probe, you notice, there's really not much here. She got a cleaning about 2 years ago and there's not much buildup or inflammation. At that point, you can make a decision. Does your mom want to continue with seeking treatment? So you want to complete an FMX, you want to do full data collection, you want to do a case presentation and complete the treatment? Or is she kind of just doing this as a favor for you and she really doesn't have the time to spend in the chair if she doesn't qualify for one of your exams? You and the patient have to make that decision. If the patient decides, I don't want to be seen anymore, then we move forward with just dismissing the patient. You'll reach out to your faculty, have them do a final evaluation on the patient right before we dismiss them. And we can just let the patient know, thank you for coming in thank you for your time coming in. And if we can help you in the future, let us know, reach out to us. Here's our coordinator's number. You can give them a call if you'd like to be seen for any future treatment. If the patient does decide that they want to seek treatment regardless of whether they qualify or not, so in this case your mom who probably doesn't qualify but she's thinking, you know what, I would love to help you out, maybe you can gain some experience on treating me in other ways, get a few other competencies taken care of. In that case, we will move forward with treating her as a new patient, which means we will start with an FMX and then move forward with data collection. The rest of the appointment will continue just like it normally would if she was a new patient. If the patient does qualify for an exam, that's fantastic, and obviously in that situation, we would move forward with a workup as well. Do remember that any patient that you complete an exam on, that patient needs to have a full workup and treatment plan completed before they can sit for the exam. Most people struggle in fall quarter to complete a full workup in one appointment. So that means for your SRP patient, do expect to spend at least 2 appointments before your SRP exam getting that patient worked up. If your patient comes in and already has an FMX completed, that significantly reduces the amount of time that your patient will have to spend here. So that would be ideal. But for a lot of people, that's not the case. They're screening people who haven't been seen by a dental office in 5 to 10 years. And as such, they do need that FMX, which can take up to an hour to an hour and a half to get completed, oftentimes. And by that, I do include the Health History Vitals EOIO check-in. So that is generally what we're looking for when we're doing our screening patients. Now you will need to screen 3 patients. I do recommend that if possible, you consolidate those into 1 or 2 appointments. So rather than going in and potentially wasting 3 clinic sessions by screening a patient maybe at 7 o'clock, patient doesn't qualify at 7:45, you dismiss the patient, and now you've got an empty clinic session. I do recommend, if possible, to try to get 2 or 3 screening patients in at the same session. You can stagger them, so have a patient come in at 7, 8, and then, generally most people are only able to do 2 appointments in 1 session. If we continue with only having 3 hours for a clinic session, that limits us to about 2 screenings. If we do at any point open up to 4 hours, then we can potentially bring in a 3rd screening patient, but it generally takes about 1 hour per screening patient, especially when you consider getting your chair changed over for the next patient. But I do recommend trying to consolidate as much as possible to make use of your time. So take that into consideration when you are speaking with family, friends, neighbors, friends of friends, as diverse a population as you can access, the better. When you are screening patients, especially for your senior year, we are looking for moderate to heavy calculus primarily. So I do recommend that you talk to your patients before they come in. Ask them key things about their health history and their dental history. Do they have undiagnosed disease or an illness that's going to prevent them from being seen in our clinic? If so, don't have them waste their time coming in until that is controlled. We may potentially look at discussing with them their dental health history. Do they have their molars? Every single exam that you're going to take requires molars, and it requires a contacting molar. A contacting molar means that the molar tooth is either in direct contact with another molar tooth, or it is in direct contact with a premolar. Generally, what that means is if their first molars have been extracted, there's a good chance they're not going to qualify for this exam. We do also want to try to avoid excessive restorations. 1 or 2 crowns, 1 or 2 veneers, that's manageable. But if we have a patient that essentially has lots of bridges, implants, and crowns, there's a good chance they're not going to qualify for one of our exams. We just want to try to avoid wasting the patient's time by coming in only to find out that they have a denture on top, a partial on the bottom, and only have canine to canine. They have 22 to 27. They unfortunately don't qualify for the exam. Now it's wasted the patient's time as well as your time on clinic. Your time on clinic is exceptionally valuable. Please make sure that you utilize it to the best of your ability, that you're making sure you're getting those competencies taken care of ahead of time, and you're using the time that you do have on clinic as wisely as possible. When at all possible, please make sure that you are overlapping those screening patients, especially if you have any inkling that they may not qualify, and be ready to do a workup. This also includes if the patients, when you're bringing them in, state that maybe they only have an hour. If that's the case, try to fill in that extra hour, hour and a half that you're going to have once that patient leaves. That way you don't spend a lot of time just sitting around on clinic. Now the screening patient requirement is going to be in effect for your your fall, winter, and spring quarter, which means you will need to bring in a total of 9 patients. I do have to emphasize that bringing in more patients earlier on does not count towards future requirements. So fall quarter, you decide to bring in 6 patients, that is simply meeting your fall requirement. That's not going to transfer over. Those 3 additional patients are not going to transfer over into winter or into spring. The rationale for this is that we want you constantly looking for patients that are going to qualify for not only you, but your classmates as well. And as we get closer to boards and we have to start looking at securing board patients for everyone, it's really critical that we are able to obtain ideal patients for each one of you. This generally requires that you're screening throughout the entire senior year. Screening everyone in October doesn't really do much for you in May, in the sense that we would just be kind of waiting on those patients, and you would really have nothing new to work on in between them. We do have periods of poor scheduling with our clinic, which means that there are oftentimes a week or 2 where our senior students will be struggling to obtain patients. So that routine screening process every quarter helps ensure that if nothing else, you are going to have a couple patients to at least get worked up and get some competencies completed on. Recognize that the screening is not just to get your exam patients, but it's also to help find patients who may need other treatment, especially treatment that falls within your competency requirements. Specifically, the perio reeval and calculus assessments are exceptionally difficult for students to obtain. The perio reeval competency, for example, requires that the patient return 4 to 6 weeks after having their treatment completed. That treatment has to be either scaling and root planing or scaling in the presence of severe inflammation. A lot of times students don't start thinking about that until spring quarter, when they're finishing up some of their scaling and root planing patients. And then at that point, they don't have 4 to 6 weeks left to bring those patients back in. Not to mention there's other concerns with bringing patients in to get them worked up for boards or for CBC exams. So I do emphasize that those screening patients that you bring in, even if they only need a couple teeth to scale and root plane, that is excellent experience, and it will really assist you in getting some of those competencies taken care of. So as an overview, you will be required to bring in 3 screening patients each quarter: fall, winter, and spring. When you bring those patients in, please try to do your best to consolidate them into as few appointments as possible. In addition to that, when you bring your patient in, they are going to have to complete all of the new patient paperwork before they can come back into the chair. They do have to have an active chart. They do have to have all of their consent signed, and they do have to have health history, vitals, and EOIO completed before we can move forward with exploring their mouth. Please inform your faculty that you do have a screening or 2 during your clinic session so that they can answer any last-minute questions that you have and help guide you through. Please do not expect your faculty to sit down and tell you specifically whether a patient will qualify or not for an exam. They can, of course, come in afterwards to confirm your findings, but it is your responsibility to sit down, to explore the patient, to probe, and to determine whether you think the patient would be a good patient to sit for one of your exams. Please refer to the exam flowchart that is available on Canvas to determine which patients are going to qualify for which exams. We will go through, of course, in seminar, the specific PowerPoints that are related to each exam, but that flowchart is helpful when you're kind of wanting a broad overview of what patients you're looking for to fulfill your senior requirements. I hope this has proved helpful to give you a basic understanding of the screening process at Loma Linda University, and if you have any follow-up questions, please feel free to reach out to me. Thank you so much.